Welcome to Beyond the Visit, the official podcast of Visiting Aid. I'm your host, Jill Barrens, reporting live from New York City, where the hustle meets home care innovation. This is where I'm going to connect you to our partner disruptors, the doers, the decision makers who are transforming home care behind the scenes. If you're tired of the same old platforms, processes, and excuses, you're in the right place with Visiting Aid. Welcome to Beyond the Visit, where we go past the paperwork, skip the buzzwords, and get real about what's driving home care forward. Today's guest, a total game changer in the home care training space. I'm talking about Avi Singer, CEO and founder of Showed Me, the platform that's making compliance cool again. We're diving into how they're transforming the way agencies train, onboard, and stay compliant without the headaches. Avi, welcome to the show.
Thank you so much for having me, Jill. It's been a long time coming. We've known each other for a long time, and I appreciate you having me on.
We're very excited to have you. So let's start from the top. You're not the typical CEO. You came into this space because you saw a very real problem. Tell us about that. What sparked Showed Me?
Great question. So just a little bit of my background. I actually started out in HR. So human resources, I was working for tech companies in the city, doing a lot of stuff around learning and development. So was very focused on that. After working for a few companies, I decided to start Showed Me. And the initial iteration of Showed Me was actually a peer-to-peer learning platform. So nothing to do with healthcare, nothing to do with compliance. It was simply mentoring, coaching, knowledge management within organizations. And that's where the name Showed Me actually came from. People ask me about it and they say, where does it come from? And I said, well, if you work at a company and someone says, well, how do I use the software? And they show you, so then you say, hey, someone showed me, right? So it was always about people within organizations training other people. But fast forward a little bit, I was looking for something a little bit stickier. In SaaS, you want to be a need-to-have platform, not a nice-to-have platform. I always talk about that. And while I was sort of looking to make our platform stickier, I had some friends who were in the healthcare space, and home care specifically, and they came to me and said, hey, you do online training. We have thousands of aides, across the state of New York. We're trying to train them on an annual basis. It's almost impossible. Is this something you could help us with? And really, I did two things at the time. So number one, I knew nothing about home care. So I just started going to home care agencies and watching what's going on over there. And it was rough. I would walk into an agency and there would literally be dozens of aides coming throughout the day, every single day, because they needed to get their in-service done. And you had patients coming in the door, you had aides coming in the door, you had people there for onboarding, you had people there for in-service. It was a huge mess. And that was one thing I said, hey, yeah, this is something we need to solve for. The second thing that was interesting was, although we were ready to do it and ready to jump in, New York State wasn't quite on board with it at first. And we really had to spend a lot of time with the Department of Health explaining to them why we thought that online training would benefit home care and the agencies. And it took some time, but we got them on board with it. And they recognized that, one, online training can sometimes, in some scenarios, be better than in-person training. And it was certainly going to make life a lot easier for the agencies. And I spent a lot of time with them, explaining to them, how we would be compliant and how everything would work. And it was a little bit of a new experience to them. But fortunately, in 2017, they came out with a DAL that said, hey, you can do online training and this is how it should function. And that's what we launched. So we've been at this since 2017. I always proudly say the first three agencies that were willing to commit to us are still clients of ours today. So very, very thankful to them for trusting us and something that was very new for everyone in the state. So that's us. And since then, we've expanded into other areas. So we do skilled nursing, assisted living, home care, home health, and hospice. We do some behavioral health. But it's been an incredible ride, and I've loved every minute of it.
Amazing. So you basically took what every HR director has nightmares about and eliminated all that manual compliance tracking, manual training. You said, let's fix it. I love that.
Yeah. And that's really what it was. I mean, I remember after about a year of working with one of our first agencies in 2017, they called me very proudly and said, hey, Avi, we no longer have a training room in our office anymore. We do some, we have a small room for some onboarding, but not a room that needs 40 or 50 people in there for mandatory. So they were totally bought in and sold on it. And I think that was when I realized, yeah, we've really solved something here. That was exciting for me. And we realized that, yeah, this is something we can certainly build off of.
Amazing. I would love to have that extra space in my home care agency.
Everyone does.
So for people listening who haven't heard of Showed Me, can you break down what actually the training module does? Because it's not your typical login and fall asleep learning management system.
No, it isn't. And I think that's what people were, when they came and were asking about it, they also were explaining to me at the same time, like, this is a very different industry. These are not financial service professionals sitting at a desk or engineers. These are not people who are comfortable with online training. And I really had to go in and really learn, okay, what does the average home healthcare aide look like? And what, and understand that, maybe they've got some technological challenges, and maybe they've got some language barriers, and maybe certain language that we might use for people with a master's degree or a graduate degree, like a nurse or a therapist, may not be the same language you'd use for a caregiver. So that was a lot of time and effort that we spent there. And we did three things really. So number one, we made sure that our platform would work well for this audience, a low tech audience. And certain decisions we made early on were really based on that. Like, how can we make this a great experience for somebody who's never used technology before? And I think we really figured it out. We've been able to help other companies who are kind of struggling with adoption and engagement also figure out, like, how do I get home healthcare aides to actually use software? So that's been great. The second was understanding the content. We have very unique content. It's not just your cut and dry. Well, these are all the compliance requirements, so let's just list them out and that's it. And then we'll move to the next slide. We want it to be compelling. We find that there's a direct correlation between user satisfaction, adoption, engagement when you make compelling software. Our head of compliance education, Emily, is actually presenting this next month in Vegas, but most of our training actually has a story arc to it. So we're not just training on OSHA or HIPAA or infection control or heart disease or things like that. We're actually trying to make it into something that people are actually interested in knowing, okay, what's the next slide? And it's not just click here for next slide or click here for next slide, but really I want to know, like, what happens next? How do I handle that? What's the experience like for the patient? What's the experience like for the family? So we really do spend a lot of time on the content. And then the third one is really our biggest differentiator, is that we understood that administrators, directors of patient services, nurses are just overwhelmed with other work they need to be doing. And being an LMS admin, so again, we're an LMS, a learning management system, being an LMS admin, they don't have the time for that. They don't have the time for setting up the training. They don't have the time for setting up users and onboarding users. They don't have time to be doing tech support. And we completely changed that. So we are a full partner, and we handle everything for our clients. We handle setting up the training based on the state that they're in and the type of training that they need. We handle onboarding their users with our integrations with systems like Visiting Aid and other platforms out there. And then we also even handle the end user technical support. We may be the only platform doing that, but if an aide is having trouble logging in, or the video is not playing, or they can't get to where they need to get to, they're reaching out to us through chat, through text message, through the phone, and we're supporting them. And I think that's been a game changer for our clients, and certainly something we're very proud of to be able to offer.
That just enhances so much of our synergy. At Visiting Aid, we're really focused on the caregiver experience, whether it's helping them utilize the platform, log in, use an e-timesheet, access the app. And we do as well, we provide direct support to the caregivers. So we're right on trend together.
That's great.
So we're not just selling software, we're selling support. It's a big deal in home care, where most tech feels like, here's your login, good luck.
Yeah, exactly.
So let's talk about pain points. You and I both know that home care operators are buried. Turnover, audits, constant state requirements. What are you seeing that changes after someone comes on with Showed Me as opposed to before?
So first of all, there's always a lot of doubt. I think a lot of home care agencies out there have been sold various software and made certain promises over time that things would happen, magically, and it doesn't always happen. And they're always a little bit, concerned or have some doubts as to whether or not this one's really going to, meet the commitment or the promise. And that's very important to us. It's very important to us that they have a great experience. So we show them right from the start, right from the implementation, that no, we're handling this. Like, we're not training you on how to do the things that you think you're going to have to do. We're doing those for you. We're just asking you the questions. What do you want to train your employees on? What does the cadence look like? And what's important to you? And that's a big aha moment for a lot of administrators and other people who are responsible for the compliance training, to know that there's a partner out there who's going to really handle this for them. And they love it. So what it's doing for them is, number one, they feel confident that if they get audited or anything that's going to happen along the way, they're going to have their paperwork is going to be there. Their account manager is going to be able to provide all the certificates and all the reports that they need. That's number one. So they just go into the year knowing, these are all the things I'll have to get done in 2025 or 2026. And they know, hey, training, Showed Me is going to handle that. And I think that's really why a lot of our clients stay with us. Number two is just putting hours back in their day. This was something that was a full-time job for large agencies who may have a few thousand aides out in the field. This is a full-time job for multiple people. We have one agency right now, and or years ago, they told us there are 5 or 6 people at our agency, and all they do is training. Coordinators, working on schedules. So not only bringing aides into the office, but also backfilling, right? Patients still need to be seen by a caregiver. So who's backfilling that caregiver while that caregiver is doing their in-service? And then nurses and directors of patient services who are standing in front of a classroom all day, just, reading the same PowerPoint over and over and over to an audience, instead of doing all the other important things they need to be doing, like, focusing on patient care and focusing on all the other things that they really want to be spending their time on, improving care. Not that training doesn't improve care as well. It is a certainly important part, but if you can partner with somebody like it showed me, and we can take that off their plate, it just, it just makes them that much happier. And, other verticals we've gone into, they're seeing the same experience. So, home health and hospice and skilled nursing are having the same experience there.
Well, it's wild the amount of time, money, and space that you're saving these agencies. You've built a system that really takes that off their plate. This is gold.
Yeah, I appreciate that. Thank you. Yeah, and that was also something that I think we're very proud of. When we sit down with the agencies day one, and again, this is something they've been promised by lots of people. This will save you money and save you time. And there's always like, but will it really? And I remember going to some of our early clients and saying, like, I think this is going to cost you 20% or 25% of what you're currently paying for nurses, and directors of patient services and HR people who get paid at a premium. I think it's going to be significantly less. And I've yet to have anyone come back, maybe a really, really small agency, a handful of patients and employees, it might not be worth it for them, but I've yet to have anyone come back and say, oh, no, this was costing me less, in my old model or the old way I was doing it. So that's always great when you can make a claim to something and then actually support it.
Well, it's actually absolutely brilliant. I personally ran a very large Lixa in Flushing where I had 40 employees that worked 7 days a week alternating just to handle in-service and orientation.
Yeah, absolutely.
So let's get into outcomes. What are agencies actually seeing after implementing Showed Me and Visiting Aid? And how does that partnership enhance operational efficiency?
So, the other thing that I think a lot of agencies are concerned about, they have this with other experiences, is that there's still a lot of administrative and manual work with any software because there may not be an integration. That means you've got to be able to be pulling rosters from one system and sending over the other. You've got to make sure that you're pulling accurate reports and then sending to the other one. And, things get lost in spreadsheets, things get lost in email. That never works. And therefore, from day one, it's always been our goal to make sure that we're integrated with anyone that our clients are using. So whether it's the EMR system, EHR system, whether it's the payroll provider, so like with Visiting Aid, it's the ability to, on a regular basis, on a regular cadence, daily basis, be able to pull user roster. So who's active and who's no longer active. We know there's a lot of attrition in the healthcare space. We know that people leave, and therefore we need to know, okay, but who's working right now? That's number one. What role do they have within the organization? What's their language preference? Like, there's so much great data we can pull from an EMR system. Or an agency management software system that then let us do what we have to do without having to ask the agency or, send me an updated spreadsheet on a weekly basis or a daily basis, whatever that is. So number one, any integration is going to save, again, hours and hours of work. And then not only hours of work, but then also the potential risk in data not transferring properly or data not being sent over properly in the email or the wrong spreadsheets and all these other things that could happen. And then we have the ability to push it back as well. So, Showed Me is not really a system of record. We're not an agency management software. We're not a payroll system. I wouldn't call us one-time use, but, we're just there for when training is needed, to be honest. So when that's done, what agencies want to see is, okay, so, what about pay codes? I got to pay my aides for this time. What about documentation or other things that I need to keep track of? We have the ability to push that back as well. So we can push that data back into systems like Visiting Aid, make sure that they have it, make sure they only have to log into Visiting Aid, they don't have to log in anywhere else. And that really makes, again, the administrative burden, something that otherwise would take a couple hours a week, that much easier.
Yes, our API with the LMSs is seamless. So we love that. Let's look ahead a little bit. Where's training headed in home care? What's next for Showed Me and for this space overall?
Yeah, great question. So, we're very fortunate. Our clients come to us all the time and ask us, what else can you do? And we try to stay in our lane. We're not going to become scheduling software, and we're not going to become, staffing software, and we're not going to, there's just a lot of areas that just like, there isn't a need for that. We haven't seen a need for that. The next thing that we're actually launching, so we actually have a new module that we're launching. That's really our second module. I mean, we've done some onboarding orientation as well, but training's always been our primary thing. But the next one we're doing is actually competency management. So skills assessments. Another huge headache that our clients have been after us for years now and saying, you need to help us with this as well. Employees need to be reviewed by a nurse out in the field doing their work. And they certainly need lots of stuff. So one is, just managing that. So, who needs their skills assessed, who has to do it, all the checklists, manuals and procedure documents. So that's the next thing that we're in the process of launching right now. So we're very, very excited about that. We look at it as something it is in line with what we do because it falls under compliance. So now we'll have training, we'll have the ability to do the skills assessment. We also have these procedural documents. So if someone needs to review, some of the things that they're getting assessed on, they'll be able to review those. So we're really excited about that. And also we're excited to try to really get beyond the checkbox. I think compliance is a checkbox, and even our competency management is, again, checking a box. What we're really excited about is really getting into improving care. I think that's really where we want to be in the future. I think it's something we want to be able to start getting involved with our clients and measuring. I think that's where healthcare is headed in general. We've been talking about value-based care for years now, not necessarily seeing the impact, but I think that will continue to happen. We want to make sure that our clients are not just seen by departments of health as compliant and doing what they're supposed to do and being up to speed and doing all that, but we actually want to see them as premier organizations that are providing incredible care in key areas like memory care, which is of course a very, very hot topic, in areas like the value-based sort of areas like sepsis and anemia and health, all the clinical areas. So we're excited about that as well, and we've really made a huge effort over the last couple of years on our content to ensure that it's not just your typical OSHA, HIPAA, infection control, but really getting we have a really robust library around daily activities. We've got a library of content for dementia and Alzheimer's that was approved by the state of Florida, which was really important for us. That was a big move for us, and we're in the process of getting it accredited to other states and national boards as well. So really looking at that as a big next step for us. How do we measurably improve care together with our clients?
I love what you've done. I'm particularly excited to learn more about your competency and skills assessments. That's going to be a private conversation because when I ran Lix's, it was crazy. Yeah. Getting everything scheduled, making sure someone was there on time, making sure the nurse shows up at the right time, and the aides that they needed to supervise didn't call out at the last minute. There's so much time and financial savings to that model. Super excited.
Yeah, we've done a few webinars so far with our existing clients, and they're incredibly excited about it. Can already see, again, just the way to be able to keep track of all that, everything that has to happen, all the, nursing schedules and things like that, and who has to be assessed. But then also having the digital checklist built into our platform all in one place. You have your records and reports for every employee all in one place across all those have been huge. And we've got some other really, really cool things in the pipeline around those areas as well.
I'm particularly excited about introducing that to my visiting aid clients.
Excellent.
Avi, thank you for being here and for proving that training doesn't have to be boring or clinical. You're helping agencies stay compliant and connected, and that's what this industry needs. For our listeners, if you want to make compliance easy and actually get time back in your day, go check out Showed Me. Don't forget to subscribe, share this episode, and follow Beyond the Visit app on Spotify, Apple Podcasts, and LinkedIn. I'm Jill Barrens. Thanks for listening and for always going beyond the visit.